Almost every single one of my clients who has used nicotine gums or lozenges before they started working with me was using them all wrong and thought that they didn't work. So I want to break it down for you and tell you exactly how to use nicotine gums and lozenges. First off, what is a nicotine gum? So nicotine gum is like a regular gum, but it has nicotine in it without any of the other chemicals that are usually found in cigarettes that could be toxic or harmful. So it's a clean form of nicotine in a gum form. The gum looks like a regular piece of gum, and it usually has a crunchy coating around the outside and then the soft gum on the inside. And lozenges are the same way. They look very much like a normal lozenge, but they do have nicotine inside. The way that you're going to use a nicotine gum is you're going to actually chew it a couple of times, and this will release like a peppery, kind of tingling, warm sensation in your mouth. And instead of chewing the gum like a normal gum, just like chew, 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 you're going to do something called the chew and park method. What this means is that you're going to chew the gum a couple of times, and then you're going to actually park the nicotine gum in between your cheek and your gums, because that's actually where the nicotine is absorbed. Same thing with the lozenge. You'll put it in your mouth a couple of times and then move it to one side of your cheek and let it sit there. You should feel like a warming sensation, tingling sensation in your cheek or in your gum area. And once that sensation goes away, you're going to put the gum or the lozenge back in the center of your mouth. If it's the gum, chew it a couple of times. If it's the lozenge, you're just going to kind of suck on it for a little bit. And then you're going to put it onto the other side of your mouth where it's going to park again and absorb through the lining of your cheeks. A common mistake that people make with the nicotine gum or the lozenge is they treat it like a normal gum or lozenge. And the reason why that doesn't work is twofold. One, you're going to be absorbing the nicotine in your stomach instead, which gives you a lot of side effects like hiccups or upset stomach. And then you might not want to use a nicotine gum or lozenge. And nicotine just absorbs faster and better through the lining of the gums and the cheek than it will through your stomach. And so oftentimes people will say that, oh, the nicotine gum didn't work for me, or the nicotine lozenge didn't work for me. And chances are they were probably using it wrong. The other reason why nicotine gums or lozenges don't work for most people is because they have it right after coffee or right after eating. Those are two huge triggers for people when they eat a meal and they're feeling really full and they want to finish digesting, or after coffee, because that bitter taste of the coffee usually makes people crave a cigarette. When you're in those situations and you crave a cigarette and you decide to use maybe a nicotine gum or a lozenge instead, it probably is not going to work for you if it's within the first 15 to 30 minutes after that happens. That's because either food or coffee or different things like that can be quite acidic, and it changes the acid-base balance in your mouth, or the pH balance of your mouth. So when you use that nicotine gum or lozenge, it may not be as effective because your mouth's balance or pH has not kind of reset. So I always advise that for at least 15 to 30 minutes after a meal or after drinking coffee, soda, anything like that, that you wait before you have the nicotine gum or the lozenge, because that way it'll actually work. The last thing that I always tell all my clients when they're using nicotine gums or lozenges is you do not need to finish that gum or lozenge. You don't need to wait until all the flavor is gone or that lozenge is completely dissolved before you spit it out. Now, if you're on a tight budget, some people will choose to save the gum or save the lozenge in like a little wrapper and then use that again next time when they're having a craving. But if you are able to purchase a box of nicotine gums or lozenges and you have the financial means to use a new one every single time, then that's a great way to help you keep track of how many nicotine gums and lozenges you're using and always starting off with a fresh one. So hopefully some of those tips helped. And if you've ever used a nicotine gum or lozenge and thought this is not working for me, try some of these strategies and let me know in the comments if it worked better for you this way. Bye.